This is our 19th Advanced Health, so we're very, very proud that we've been pushing through and getting all of these great speakers talking about these very important topics. And today's topic couldn't be more important to not only to women but also to the men. So we have a few men in the room, and I'm happy to see them. I just wanted to welcome all of you to Dubai Science Park and to Advanced Health. Obviously, we do these events every month or so. So the next one that we will be having will be during Arab Health. So we look forward to your participation as well. And today's event will be moderated by Dr. Sarah Rasmi, who will be leading the way and asking all the difficult questions to the panelists. So make sure that you have your questions ready as well. And I look forward to interacting with all of you. Thank you very much. Over to you, Sarah.
Good morning, everyone. Thank you for joining me here today for a topic that I'm sure is very near and dear to all of our hearts, women's health. I think one of the things that we probably want to do before we begin our presentations and panel discussion is take a few minutes to reflect on the status quo. So currently what we see all around the world is that women, as you know, are taking on a lot of the traditional caregiving roles in their communities. At the same time, they often struggle to care for themselves in the way that they care for other people. And that might be because of not being able to prioritize their own physical and mental health, and it might also be because there are issues with access to that health care. So I'm very excited that we have a wonderful panel here today to talk to us about the situation, as well as some strategies that we can do to try to close the gap and improve women's health. So what we're going to do is we're going to have each of our panelists do a short presentation, and then everyone will join myself on the stage. We'll do a panel discussion, and then we will end with some questions and answers. So without further ado, I'll turn it over to our first speaker, Noah Hefney, CEO and founder of People Impact.
Okay, so I'd like to start by saying that, women's health is an undeniable human right. This is not a question of, investing here and there in organizations or improving, the status of infrastructure and doing this on ad hoc basis. We need a holistic approach, and we need a rights-based approach to ensure that this right, a human right, is really accessible equitably by all, both men and women. And as we've heard from Dr. Sarah Rasmi, we know that the pandemic has had tremendous impacts on women, including, women being disproportionately impacted by the pandemic. And that is equally in the area of health, and I'll be explaining shortly why. So these impacts, whether they are social or economic, are going to have a very long-term effect, and they're going to require systemic change. They're going to require a bold leadership commitment and also taking a data-centric approach to addressing them. So it is very important as organizations navigate how to address, granting women and men equal rights to health, that we start with a very clear data baseline and measure our efforts as we go along. If we don't do that, we risk, again, tackling the issue in a very non-systemic way, in a very reactive way, which will not yield to the same impact that we're looking for. So here we go. So when we look at the pandemic, women have been at the forefront of that. So as nurses, teachers, doctors, caregivers, and, their role is undeniable in how they navigated. There was tremendous courage in how they navigated, but also beyond those roles that you see on the screen as leaders. Women during the pandemic showed us that women's leadership matters. So, from Taiwan to Germany to New Zealand, we saw leaders navigating these crises and even navigating better. And it's not because women lead better than men or men lead better than women, but by the natural traits of women leaders. They were able to treat this crisis not only effectively, from a government or business perspective, but with empathy for the people, with a lot of humanity, so humanizing leadership. When I say they're disproportionately impacted, it's because, women make up 70% of the healthcare workforce globally. And again, yet they only represent 29% of the leadership roles in that sector, which is very low in terms of representation number. And also still across the world, they are, women generally are underpaid between 20 and 30% less than men. So, again, this really points to the inequality in terms of pay and in terms of leadership representation. They are also in the pandemic and until now at higher risk of infection because they constitute the majority of the informal sector. So there are lots of women, 55% of the world of women are working in the informal sector. This makes them more vulnerable. They take public transportation and therefore at high risk of infection. There is in some lower income countries, lack of access to masks and other protective material. So again, at higher risk. Teachers, are also caregivers. So we also, all the mothers and fathers in this, place to this morning have seen how, we all had to turn our roles into becoming teachers at home. But if you were actually a teacher, you had to add to that role, a caregiving role, which is, again, something that you had to take over as a woman beyond the role of men. Another aspect that is very important is that, globally, 1 in 3 women are affected by violence. And during the pandemic, we saw a spike in domestic violence at 25%. And this is again labeled by the United Nations as a shadow pandemic. And shadow pandemic because it's not spoken about. It is the stuff that happens behind doors to women and that impacts their economic empowerment. If we look at the situation with jobs and the impact of COVID, women's jobs are 1.8 times more vulnerable to the crisis than men's job, according to McKinsey. Depression is twice as common among women than men. And lastly, there was a research carried out by Bupa in 2021, where 2/3 of the women who responded, 66% versus 57% of the men, believe that the pandemic has had a negative impact on their health and well-being. So, as a result, based on all of this, we know that there is an increase in stress and mental health issues. The Bupa census as well is showing us that 32% of women felt their mental health was negatively affected. And this is really driven by the blurred lines between work and life. We took work home and we're not used to that. For some women, it actually worked well. And there is a great demand for extending remote working policies, programs, etc., to enable women to balance work and life. But for some, it has actually added to the care responsibilities, the ability to manage work and life. And again, this has all resulted for some women to additional stress. So, if we look again at the numbers relating to leadership representation or access to jobs, so the economic empowerment angle of these health issues and impact of the pandemic, we'll see that women are losing jobs at the moment at a rate that is higher than men, 5% versus 3.9% amongst men, according to the ILO. Secondly, the women, when the care establishments closed, the housework fell disproportionately on women, leading to less productivity in some cases and to mental health and stress. As the job market recovers, LinkedIn also shows us that women are being hired at a slower rate in multiple industries. This is a new trend that's appearing through the data. And also, they are likely to be hired. They are less likely to be hired for leadership roles, which is resulting in a reversal of 2 years' progress on the, achieving economic gender parity. So it's very important to understand that when we look at this picture, it's really important to look at this systemically. These are not issues that are emerging now only because of the pandemic. The inequalities have been there year over year, with women disproportionately affected across socioeconomic spheres. However, the pandemic has definitely increased that and has created a disproportionate impact for the women. So organizations are really going to need to rethink how they re-engineer the workforce, the policies, the programs. There's going to need to be a change in leadership models and cultures to a more inclusive workplace that takes into account and puts women and girls' needs first, and men as well. So it's more about inclusion moving forward. It's more about, driving diversity, equity, and inclusion. And I say equity and not equality because there is no really one size fits all. Every organization is different. Every industry is different. And women are already behind in terms of inequalities. So we need to look at equity. We need to look at how we create fairness and we bring them up to speed so that they can have access to their rights. So moving on, I just want to touch very quickly on the gender gap. If we look at this slide, the numbers are very clear. We have another 135.6 years to close the gender gap globally. And when we look at the economic gender gap, the number is much greater. It's 267.6 years. So here, what we see here is like a picture that is very disheartening. We think, okay, so what can we do about it? But the reality is every single action matters, and it's not a question only for governments to tackle. So, for example, here in the UAE ranks #1 on the Gender Equality Index of the World Economic Forum. But what is the private sector doing as well? The private sector is actually behind. The private sector needs to step up with particularly two aspects. One is leadership representation, and two is addressing unequal pay. And if we can do that, there will be a tangible shift in the way we drive economic empowerment. And today, there are many organizations that are advancing diversity and inclusion. They are dedicated to transforming organizations to make them more inclusive. We are seeing progress on diversity numbers, metrics, etc., but little progress is happening on inclusion. So if I could also talk about the Mena region for a moment, this has the largest gender gap in the world at 39%, and the low, it's the lowest rate in the world in terms of gender gap because it's driven by a low labor force participation, which stands at 31%. So we also need to develop the pipeline of talent that is entering the workforce and to enable them to, have the confidence and the empowerment to drive within that workforce. We need to look at ways to retain and ways to grow these women into leadership and retain them throughout the course. So it's important when we look at these numbers, 267 and 135 years, which is, again, what do we do about it, to understand the drivers. So there are two opposing trends when we look at this gender gap. So there is, on the one hand, an increase in the proportion of women-skilled professionals. On the other hand, on the opposing side, you have income disparities that persist and few women in managerial positions. So the income disparities I touched upon, the gap is 20 to 30%. Women are being paid less than men by 20 or 30%. And in terms of leadership representation, well, again, it's very low, and the trend has regressed in the pandemic, with the exception, actually, of the healthcare industry and IT and manufacturing sectors. So the good news for the health industry is that, you're really placing a focus on transforming organizations and getting women to the leadership, and that trend must continue. So it's time to translate, goodwill into action. We've been talking about gender equality for years. We've been talking about diversity and inclusions for years, and it's important in order to really drive change to transform our mindset. This is not just a social and moral issue. This is a strategic economic opportunity. Actually, delivering on our promise to drive economic gender parity is a business case, is an economic case that can yield to $28 trillion to the global economy, 26% more on our global GDP by 2030. So it's not just a nice to do on the side of the business, it is a strategic economic opportunity for countries and for businesses. So I'd like to very quickly stop here and show a quick video to show you, the big picture around the issues that women face at work.
All around the world, women want to work and get paid for it, and the majority of men agree. But there's a gap between women's aspirations and the realities of the labor market. Women are less likely to participate in the labor market. They face lower chances of finding a job. They're paid less than men, more likely to be in involuntary part-time work, and they're subject to discrimination in the workplace. In every country, women do at least twice as much housework and care work at home than men. Women work longer days than men. Around the world, women and men agree. Balancing work and family responsibilities, including lack of access to affordable care services, is the major challenge to women at work. The global pay gap between men and women is estimated at 23%. In some countries, women earn just 60% of what men earn for an hour of the same work. Differences in education, experience, age, and career breaks cannot entirely explain why. The deliberate and bold choices we make will ensure a future of work with gender equality at its heart. Major pathways towards achieving gender equality and decent work include expanding the provision of accessible and high-quality care services and creating decent jobs in the care economy. Laws and mechanisms to ensure equal pay for work of equal value. And extend social protection coverage. And macroeconomic policies that foster job-rich growth and address structural gender inequalities. This transformation is essential if we want to see gender equality at the heart of the 2030 Sustainable Development Agenda and make decent work for women and men a reality.
Okay, so in closing, I mean, I'd like to wrap up by saying there is no resilient recovery from the pandemic or post-pandemic, world that doesn't, that is going to be resilient without putting women at the forefront. Women have to be at the forefront of every decision-making effort relating to the pandemic. If we look at the role of organizations and provide a very top-line framework, because we'll talk about the actions that organizations can take in the panel discussion, but really it's a very simple framework. It's really, as organizations, as individuals, as governments, if we look at 3 action steps to integrate in our strategies, it's to plan, buy, and invest in women. So plan for women, meaning mainstreaming gender into our strategies, action plans, making sure that we have the discussion around gender equality when we develop programs or design projects, etc. So planning for women, putting their needs at the heart of our planning efforts and strategies. Buying from women, this is about gender-sensitive procurement. Are we really, buying from diverse suppliers? Are we looking at women contributing to our, business supplier base? So this is very important, buying from women. And last but not least, investing in women. And here it's investing in the women within our organizations and also those in the community in order to not to leave anyone behind. So on the socio-economic front, which is not the focus of what I'll talk about today, again, the pandemic has exacerbated all the progress delivered on the Sustainable Development Goals, with women being, the majority of those impacted by poverty, lack of access to water, lack of access to equitable health, and the majority of those, the refugee populations that have increased in terms of numbers around the world. So again, even on the social front, there is so much that the private sector can do in order to alleviate the suffering of these populations. So in closing, I just want to end by saying there's a great benefit to that, beyond the economic benefit, which I talked about, which is the 28 trillion that McKinsey tells us about that would be added to GDP. For organizations, the direct benefit, is, improved productivity. When you have inclusion in the workplace, when men and women have equal rights, equal access to resources, and empowerment for all, that drives productivity, that drives growth, that drives innovation, diversity, and inclusion provides a strength for the business to grow. The diversity enables the businesses to get closer to their consumers and reflect the diverse views. And again, we know that women are behind the majority of purchase decisions. It's a more stable workforce, happier employees, and you get improved customer targeting. So the business case is clear. It's been said time and again, but it's honestly time for action by all. Thank you very much.
Thank you very much for that. And now I'd like to introduce our next speaker, Sophie Smith, CEO and founder of Nepta Health.
Before I get started with my presentation, I actually wanted to just pick up on the last point by Noha around planning for and investing in women. I'm going to speak about women's health technologies, known colloquially as Femtech. But before I do, how many venture capital dollars do you think were invested into women's health technology companies in MENA this year? Would anyone like to guess? You, please. In MENA. Out of a total of $2 billion invested. 0. In fact, the total percentage of funding that went into female-founded companies this year in MENA was 0.9%. And I don't know if any of you here have daughters. Maybe we can do a show of hands of people who have daughters in the room. But what that means, and it's difficult sometimes to kind of make this material point, is that if your daughter was stood trying to secure funding on the same stage as a man, and the room was full of 100 investors, 99 of them would give their money to him, and just 1 would give their money to your daughter. So not only is there a significant difference in terms of the amount of capital that's been invested into female-founded companies in the region this year, it's about 50% of what was invested pre-COVID. There's also currently, despite increasing investment into women's health technologies and other kind of women-centric and women-oriented companies in the US and Europe, a distinct lack of investment into women-oriented companies in this region today. And we're hoping that will change in 2022. So I'm going to talk about women's health technologies and how we can advance women's health using technology. But first, I'm going to give you a brief history of Femtech. So women's health technologies, as an area of focus, as an industry, are actually relatively young. The term Femtech was coined by Ida Tin, the founder of Clue, which is a period tracking app, in 2016, so just 5 years ago. And you can see here a brief timeline. Pre-2014, there weren't really any companies that were focusing specifically on advancing women's health using technology. Then you saw the first kind of batch of period and cycle tracking apps, things that were trying to give women access to and visibility of insights into what we describe as women's 5th vital sign, their menstrual cycle. And then 2017 to 2020, you started to see wearables, remote care, home care, more kind of life sciences companies emerge. And now from 2020 onwards, we see the future of women's health being very much in what we've termed hybrid healthcare. So combining digital and traditional healthcare to materially improve health outcomes in women. This is a picture of the landscape of Femtech in 2019. 120 companies, 335 investors. Today, just 2 years later, there are about 600 companies globally. And the Femtech market is now valued at $1.186 trillion by 2027. And here's a bit of a breakdown. So you can see there are companies that focus on overall health, still a lot of interperiod fertility, menstrual health. There are more interperiod products now, and in fact, the vast majority of companies that we've seen in MENA that are working on women's health are in this space. So companies like Pectiv, My Lily Box, Lizom, which is an eco-friendly period care platform headquartered here. You've got companies that focus on longevity. You've got companies that are in preventative medicine, and then you've got kind of more holistic, I would say, platform plays, actually like my company, Nepta Health, which I completely forgot to introduce, but I do have some slides on it in a bit. Here, again, just going back to 2019, are some of the companies that were making waves in 2019. So Everlywell is a women's health testing company, actually recently acquired. You've got Next Gen Jane, which is sort of smart period products, smart tampons for health monitoring. So we'll give you insights about your cycle, about different biomarkers in your body. Company like Modern Fertility. So Modern Fertility was actually recently acquired by Roe, which is a kind of a platform play focused on men and women's health in the US. Core, another period product company. Peanut started as a social network for mothers and is now getting much more into kind of holistic care provision. And then some of the companies that really made headlines this year that aren't here are Maven Clinic, which is a B2B, predominantly healthcare provider that provides remote and holistic health access as an employee benefit to women in the US. They raised $110 million and became Femtech's first unicorn. Then another one was MyTier, which is again a kind of hybrid setup. They started with a women's health clinic in New York with a digital interface, and now they're rolling out more clinics and building something that is woman-centric primary care. They also raised a $100 million round at a $600 million valuation. So the amount of dollars that are going into women's health technologies outside of the region is really ramping up. And in fact, I sat on a panel with She Loves Tech, and the first question was, Femtech is finally having its moment. There's significantly more interest in it, significantly more capital going into it. Why do you think this is? To which my response was, yes, in other parts of the world, but we're still playing catch up a little bit. In terms of the Femtech focus to date, and this is relevant because we very much see the UAE as a hub for innovation in emerging markets because of the diversity of peoples here, over 200 nationalities, because of the appetite to invest in impact and to grow communities. And so most of the investment into women's health and into women's health technologies to date has been in developed markets, so in the US and Europe. And this reflects healthcare generally. So if you look at the landscape for clinical research and trials, 92% occur in the US and Europe, and the remaining 8% mostly occur in the Far East, which means that women of Middle Eastern, African, and South Asian origin are today in traditional medicine and traditional clinical research underrepresented, and the same continues to be true for the development of women's health technologies. They focused on women's health more than healthcare, and what I mean is that they focused more on providing access as opposed to improving outcomes, which are two different things. 80% of breast cancers in the Mena region today are diagnosed at stage 4, which has a 27% survival rate versus, or 5-year survival rate versus 99% at stages 1 and 2. The companies that are being built today would still be predominantly focused on providing you with information about your breast cancer, maybe reminding you to go for your checkups, as opposed to developing new ways to detect, diagnose, and treat it. And so it's the same thing, technology enabled more than health outcomes. Still predominantly focused on increasing access, which is important and historically has been lacking. But we need to see the shift so that not only are women accessing care, but they're actually living healthier, happier lives as well. This I've already touched on. The women's health market is growing at a phenomenal rate. So to give you an idea of how the compound annual growth rate relates to the regional market, so the compound annual growth rate of healthcare in general in the Mena region is just over 10%. In the US, it's about 4%. So the Femtech market is growing 3 times faster than the overall healthcare market. The largest market is in chronic diseases, and I know this is something that Pam is going to touch on in a minute. But when people think about women's health, they tend to exclusively think about things that affect women's reproductive health. Whereas when we talk about women's healthcare, we're talking about things that affect women in general, all the way through from puberty to menopause and beyond. And the reason this is important is because women until 1994 were mostly excluded from clinical research and trials, which means that still today women are 50 to 75% more likely than men to suffer adverse reactions to drugs because many drugs haven't been designed for or tested on women. So that means that, yes, women's sort of gynecological cancers are under research, but also cancer in general is less researched in women. It means that things like diabetes perhaps are under research, but it's even less researched in women. And chronic conditions that exclusively affect women are also grossly under-researched. So things like polycystic ovary syndrome, endometriosis, which affects 1 in 10 women, that's as many people as diabetes. It takes on average 7 years to diagnose and is often misdiagnosed or undiagnosed. So there's a huge market to explore and improve the treatment of chronic diseases. Fewer than 1% of Femtech companies focus on chronic disease. Yeah, again, I'll come on to what NABDA does in a minute. Inevitably, some of what I'm saying is linked to what we do with our company. But you can see that these are some of the companies that have been very prominent in women's health over the last few years in women's health technologies. The vast majority focus on fertility, which makes sense. Most women become experts in their health either when they fall pregnant for the first time or when they don't. So if you're going to build something to educate women about their health, build it when they're out there looking. But very few focus on chronic disease. And if they do, it tends to be at a particular age and stage, not taking women kind of as a holistic whole across the course of their lifetimes. Again, I've given some of these stats already about how poorly managed chronic diseases impact women at every age and stage. I've talked about the fact that the least well-served women are women in emerging markets because of the historical underrepresentation in clinical research and trials. And this is a bit about our hybrid healthcare platform. I'm not going to go into this in a huge amount of detail. If you want to find more about NABTA, you can ask me afterwards. But essentially what we want to do is we want to build a new model of care. Hybrid healthcare is our own concept. It builds on existing integrated care models through the application of 3 principles: patient centricity, augmented intelligence, so that's the combination of female, artificial, and clinician intelligence, and decentralization using ledger-based technologies such as blockchain. If people want to know why patient-centric care is important, you only need to look at women in their primary role as caregivers to understand that if you have a couple of kids and you're making 80% of the consumer healthcare spending decisions in your household, it's very difficult to find time to prioritize your health. But also you will spend hours going to doctors and hospitals, particularly with young children, trying to balance their UTIs and their cuts and scrapes and their vaccinations. So the more that we can remove care and the kind of nexus of care from traditional provider-led environments, the more we can anchor it around women, the more we can bring care to them where they are, the more productive, the more healthy, the happier they will be. I'm going to skip over this. This talks a little bit about hybrid clinical pathways. So the way that hybrid healthcare works is it doesn't focus on a delivery mechanism, such as a device or a particular test. It's agnostic in that respect. Instead, it looks at the way that care is delivered today by clinicians for specific conditions. So clinical pathways are how you get people who present with the same symptoms from symptoms diagnosis to treatment to rehabilitation. And at the moment, this process, because it's mostly driven by the provider, can be very inefficient. If you go and see one doctor and then 2 days later see a new doctor, that second doctor doesn't necessarily have visibility of your medical record, doesn't know what's happened, maybe doesn't ask you the whole raft of questions, and so things are missed. You may be diagnosed with different things on a number of different occasions. The more we anchor that knowledge and that record and that data in the individual, the less likely that is to happen. And so we have taken the first part of a clinical pathway, the bit from symptom to diagnosis. We've looked at the things that doctors use to get you from symptom to diagnosis, so triaging, monitoring, and testing, and tried to figure out how, through the application of digital technologies such as remote monitoring, wearable devices such as artificial intelligence, we can do this from home and on a woman's own time. The benefits being reduced time to diagnosis, improved accuracy of diagnosis. And they're also plug and play with existing systems, which, if you're building anything technology-enabled for women's health, is a must. My father, until recently, was the National Clinical Director of Diagnostics for the NHS, so probably the most senior person in diagnostics in the UK. And he was a national lead for the NHS's first big digitalization program, PACS, which brought all of the imaging online. And the thing that he went on and on and on about was the fact that technology is useful. It's a tool, it's not the end goal, and any technology that you use in the context of healthcare must be used to improve health outcomes, must be understood and accessible to doctors. And that's it. So again, to reiterate a point made by Noha, today women make 80% of consumer health spending decisions globally. A tiny fraction of the investment into healthcare goes to women's health, not just here, but in the rest of the world. We believe that by making healthcare women-centric, by looking at very specific technology enablers, we can enable women to make informed decisions about diet, lifestyle, and weight management address underlying causes of menstrual cycle irregularities, optimize chances of conception, reduce the likelihood of pregnancy and birth complications, improve their transition through the perimenopause and beyond, with a whole raft of much-needed benefits. So that's it. Our vision for women's health is a world where healthcare is affordable and accessible for all women, where women are empowered with resources and information to manage their health, and where as much as possible we can reduce their dependence on drugs and teach them to trust really the most important person in the whole ecosystem, themselves, when it comes to their health. Thank you. Next up, we have Noha Salem. She's a founding member of the Global Public Policy team at Organon.
Organon was born recently on the 6th of June as a spin from Merck, also known as MSD, outside of the US and Canada. As a company, we are here for a better and healthier every day for every woman. We are the largest company that's solely focused on women's health today. And our commitment as we launched was not just to launch a company, but a commitment to listen to women and to understand their needs and to work towards addressing those needs. And we do believe that the first step is to understand where these issues are, and we believe that the journey to improving women's health is really to lead to a healthier world. So when women thrive, not only do they thrive and their families thrive, but also their nations. So our vision is a better and healthier every day for every woman, and our mission is to deliver impactful medicines and solutions for every day, not just for her, but for her family as well. And we are a $6.5 billion global healthcare company with a big, diverse portfolio that ranges from women's health to biosimilars and established brands. With women's health, we're very proud of our legacy. We have a portfolio that covers reproductive health, contraception, and fertility, but we also aspire to focus on areas that are uniquely impacting women, but also disproportionately impacting her. Our biosimilars portfolio is also an area where we believe can unlock value in healthcare systems, whether it's in the immunity space or oncology space. We truly are excited about biosimilars and the opportunities they can offer healthcare systems. And finally, our established brands, a portfolio of 49 medicines, which are critical household names we're very proud of in the space of cardiovascular disease, respiratory, and pain management. And we're thrilled to be here today, and as a commitment to the Middle East and North Africa and Turkey region, we serve 48 countries, 1.6 billion people that are very diverse, 5 languages, 10 nationalities, through our 400 founders. And we are committed to working hand in hand with all stakeholders to address all the issues that impact her in the region. And therefore, we do recognize the importance of partnerships and collaborations. We know that the challenges in women's health, like Noha said, like Sophie said, is not really on one specific industry or one organization. It really is a team effort, and we recognize that, and we're really excited to be partnering with different organizations throughout the region. So on launch day, the day Organon was born, it was her day. And we launched in New York, in the New York Stock Exchange, by bringing together voices of women all over the world, including women in the Mena region. And we were very proud to launch on the 26th of October here in Manat and during Expo 2020 by looking at how can we accelerate advancements in the health of women across the region, bringing in experts from a variety of organizations to start a dialogue, which is really an important start. And also, to Sophie's point, a commitment to accelerating access to technology. So we were proud to announce a partnership with Flat 6 Labs for the Femtech Accelerator Program, looking at how can we focus on and accelerate solutions in the technology space to address women's health needs. We do recognize that this is an area that requires a lot more investment and focus, and we're here to support it. So we're inviting you also to take the microphone. Please join us in hereforherhealth.com and let us know what you think are the unmet needs in women's health, because we're here to listen and to support. Thank you. And with that, I'd like to invite Pamela Dupont.
I'm the founder and managing director of DiaPoint ME, and I started Diapoint in 2016. I left the corporate world because when my son was 20 months old, he was diagnosed with type 1 diabetes. I instantly became a diabetes expert. I'd always worked in healthcare in my professional life, so I thought I should know something about this topic, but I really didn't. It wasn't until I had to manage a chronic condition that I realized I really didn't know that much about healthcare in that context. At Diapoint, we support people with diabetes. I call it the place for people touched by diabetes because it's not just people with diabetes, it's caretakers, it's family members, it's friends. I would bet almost every person sitting here has a family member or friend or know someone with diabetes if you maybe don't experience it yourself. So that's why I say touched by diabetes. We have an online shop where we sell products and other things that people need. And we're really trying to elevate the discussion and the feeling around diabetes. Because when you hear that word, or if you look it up, you often see ugly images. When you think diabetes, you're thinking obesity or other things. And that's not always the case. We also do health and lifestyle coaching, not just for people with diabetes. I also tend to work with a lot of women in this topic as well. But I wanted to talk about women's health in general in the context of diabetes, because that is what I know. But when I started really diving deeper into the topic, I made some interesting discoveries that I want to share with you. These are the new global figures that just came out this year from the IDF, the International Diabetes Federation, for diabetes globally. This is not women's statistics, so this was global. 537 million adults have diabetes. This does not include gestational, and this does not include children that have type 1. So that's like 1 out of 10 people around the world. Often people will come up to me and they say, wow, I bet you have a lot of work to do because there's so much diabetes here. And I'm like, there's diabetes everywhere around the world. It's not just here. In 2030, they anticipate that it's going to be 643 million people. That is an increase of 46%. And in the Mena region, that's an increase of 87%. Now, one thing about the 87% increase that we should be mindful of, one reason the number is slightly higher than globally is because a lot of countries never had a diabetes registry before, so they never knew how many people with diabetes they had. The only other region with a higher increase is Africa, and it's over 100%. And I'm sure if you dove deeper into those numbers, that increases because no one was counting before. But it's good to know we need a baseline to start with. When I talk about diabetes, I talk about 3 types. There's more than 3. But the main ones is type 1, which is an autoimmune condition, formerly really known as juvenile diabetes, more common in children, but more adults are getting diabetes, type 1. There's no prevention. There's no cure. Your pancreas doesn't work because the cells in your pancreas are being attacked by your immune system. They're not sure quite why it happens. There's a lot of advancements. It's very manageable, but not easy. Type 2 happens for a lot of reasons. This is where you have insulin resistance. This is 90 to 98% of all people with diabetes, depending on where you're living. But statistically, this is where most people with diabetes fall. And it's not because you had an unhealthy lifestyle in many cases. Sometimes it is. There's a lot of talk about the reversal of it. But sometimes it's not the case. And that's a whole nother day at Science Park that I'm not going to go into that right now. And then gestational, which affects women. For, again, unknown reasons, when we are pregnant, sometimes we might have insulin resistance. So if you've given birth before, that's why we drink that really vile, very sweet stuff, and then we have to sit and wait. And then they check to see how our body has responded to all that sugar that we've just ingested. The global prevalence of diabetes among men and women. So when I pulled up the new IDF report, because honestly speaking, until I started to think about what I wanted to say this morning, I hadn't gone deep into the statistics. It's a
very large PDF document, and I did a Control F or Command F for women. Women, 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 women. And 99% of it was only about gestational diabetes, not talking about it in any other context. So I scrolled down a bit more, and I found this. Now, gestational would only happen during childbearing years. This doesn't include gestational. The bar graph on your right is gestational. That's been carved out. If we're only talking about gestational diabetes, then why is it that once a woman, as she gets older, she's catching up to the prevalence of men, and nobody's talking about it? Like Sophie highlighted, we're only talking about women's health in the context of reproduction and breast cancer. Do you know what the #1 cause of death among women is? If you don't work in the healthcare. Yeah, go ahead, Sophie. Yes, it is. It's heart disease. It's not reproductive, and it's not breast cancer. Perhaps that means that we're doing really well in those areas of highlighting it, and women are getting more checkups and earlier and things like that, but that's really interesting. And the second one is stroke. Some are preventable. Some are related to high blood sugars, if you're not managing your blood sugar well. Diabetes-related deaths in adults. This one was very interesting. In women aged 70 to 79, and I don't know if it's just because the men surveyed aren't making it that far. I hope that's not the case. But the number of women is much, much higher. We catch up by the time we're about 60. But yet we're still only focusing on gestational diabetes and reproductive health. For the Mena region, this is what I found. It's much higher in women, all the way across. So I think in general we need to change the discussion or dig deeper into this discussion around women's health and what that really means when we start addressing gaps. And even like Sophie said, traditionally, only men's health was looked at. There was not a lot of research about women's health. And historically, women were seen, yes, we are, the child-rearing people, and that is the focus. No one ever thought that we might have other health issues. So I just want to highlight some of those other conditions I mentioned. Heart disease. And I found the statistic, blood pressure is a big issue for women. Only 1 in 3 women worldwide reported that they had their I say blood sugar like 50 times a day, so it's just a natural thing that comes out. Had their blood pressure tested in the last 12 months. That is shocking. We should all be at least going for a checkup once a year. And it's so easy to test your blood pressure, and it can be treated. Cancer, the 3 most common, breast, lung, and colorectal. But just as many women get breast cancer as they do lung cancer. And I bet, even though breast cancer is often found very late, as Sophie highlighted, I'm sure lung cancer is found even later because we're not even thinking about it. Stroke. Mental health, this is a huge one. I think we still don't even understand the impact. Of course, it's being more deeply researched because of COVID and because of the impact it's had on everyone. So we really need to look at what that means for women, and that's been highlighted throughout the morning. So I thought, what can I suggest, or how can we address these issues? And I see 3 main things. The first one is access, always. Not everyone in the world has access to what they need, to basics. I know people that drive 3 hours in some countries of the world just to get insulin. It's pretty shocking, the gaps. And there's a lot of organizations working on that, I'm happy to say. and doing some amazing work around that, but there's still a lot of gaps in the access. After we have access, though, we need education, not awareness, because there's awareness for so many topics. We're all aware of diabetes. We're all aware November is Diabetes Awareness Month, but we don't really know what that means outside of blue ribbons. We know October is Pink Month, but we could all use more information, and by information I mean better education around these topics. Here in the UAE, we have access, and we have education, and we know a lot of these things, but we're not taking advantage of it. And I think as women, and the women I talk to, and the women I support and I work with, one reason why we're not taking advantage of it is because we don't give ourselves permission to do it. Or we don't make the time to do it because we're too busy taking care of everyone else. And we do that from a place of love, and we're very happy to care for our children and our families, and that's what we do. But individually, we have to take care of ourselves because no one is going to stop and do that for us. So those are the three things that will close this gap. What does that mean for you as an individual? It's all about your lifestyle. And this is not one of those talks where I'm saying that change your lifestyle and reverse your diabetes. I am a lifestyle medicine coach, and what we do in our life and how we manage our lifestyle and what we put in our bodies and our minds affects everything, and it affects our health. And particularly a lot of those common causes of death among women, like heart disease, some type 2 diabetes, can be better managed or reversed or even preventable if we take care of our lifestyle. And by that I mean eating smarter. What is eating smarter? I'm sorry for all the keto people, but more plants. There's a lot of evidence around the need to eat more plants, plant-based. I'm not anti-meat. If you want to eat meat, that's great, but you need more plants, fruits, and vegetables in your life. That's the smallest, easiest thing you can do. We need to move more. We all know this, but we don't do it. I even don't do it. I once had a trainer, he made me track my steps every day. I was like, are you kidding me? I hate it, but it made a difference. It really did. We need to sleep better. There is so much evidence. I say the easiest one is eating better, but it should be sleeping, because all we got to do is go lay down. We don't even have to make any choices, but we're not sleeping. And even now, a lot of the time, if someone is presented to an endocrinologist as pre-diabetic or with type 2 diabetes, one of the first questions that they're going to ask is, how are you sleeping? Because there is evidence around sleep apnea causing insulin resistance. Our body needs sleep, and we're sleeping less and less all the time, and we're distracted, and we're not getting good sleep. Manage stress. I don't quite like that term, because stress is something we have to dance with. We shouldn't try to manage it. We should take breaks when we need it. We should ask for help when we need it. Reach out to someone to support us with our mental health. That's how I define managing stress. Cultivate relationships. I've noticed that in this kind of post-COVID era, when I'm out doing the simple things like grocery shopping or whatever, I didn't realize how much I missed the interaction with just like the guy weighing my fruit. It's insane, but I was like, oh my gosh, like, how are you today? We need relationships, whether they're near or far. We are not well when we're not feeling connected. And avoiding risky substances. I think we all know this. Whether it's smoking or if you drink alcohol, that also has a direct impact on your health. And that's all I have to say for today. Thank you so much.
We are going to start our panel discussion and the question and answer period now, once we're all on stage together. Okay, so I'll start with a question to Noha Hefney. How has the pandemic impacted gender equality, and what kind of effect did it have on women's healthcare?
Yeah, so as I presented this morning in the presentation, clearly there's various impacts, whether on the economic or social front. So in communities, we see women greatly impacted by different socioeconomic problems, poverty, hunger, lack of access to clean drinking waters. If the numbers before the pandemic were at, I don't know, women always constituted the majority of those impacted by these socioeconomic issues. But if the numbers were, for example, at 50% of 1.2 billion, having access to electricity, or 400 million who have no access to clean drinking water, these numbers have increased. We know from the UN data that 50 million more people are going to be subjected to poverty. Again, the majority are women. Now, on the economic front, as described earlier, women are losing jobs at higher rates than men. Women are, because of the added care responsibilities and, that has been imposed by the pandemic, are being impacted in terms of productivity, mental health, additional stress. That is something they need to manage. So again, that will impact retention in workplaces. Workplaces need to think very carefully how they re-engineer the future of work, how they amend policies to provide flexibility for women to manage their life, and also to recognize that it's not one size fits all. So if some women prefer to work from an office while others can manage better their household responsibilities and additional responsibilities by working remotely. So we really need to talk to women. And someone was mentioning earlier, listening. So a lot of what we've been doing in the past as leaders is, top-down approaches. And again, that needs to change. We need a two-way approach to communication. We need to listen to the women, to their needs, and capture that within the development of strategies. So the impact is massive, it's disproportionate, and it's exacerbating inequality. And I think it will need for all of us collectively to double our efforts if we really want to make a difference on SDG 5 by 2030, whether private sector or governments across the region, to really step up the effort. That requires bold commitment, that requires cultural transformation, mindset transformation. So
thank you. And I think you bring up a really important point. Throughout the course of the day, we heard a lot about the current state and a lot of the gaps and challenges that we're currently facing. But with any gap, there comes opportunity. And I think everybody here has highlighted some of the opportunities that we can pursue in order to close some of these gaps and improve the access as well as the outcomes for women moving forward. With that, I'd like to turn to Noha Salim. And my question for you is, you mentioned that Organon is focused on listening to women's needs. What are you hearing so far?
When we launched our company, we launched a commitment to women's health and also to listening and understanding their needs. And by creating a global platform, and just a few months in, we've received thousands of notes from women from all around the world with talking about a lot of unmet needs, a lot of issues, and top of them was mental health. We talked about menopause, we've heard about polycystic ovarian syndrome, we've heard about endometriosis, but also about gender equity, diversity, equity, and inclusion. And, this really resonates because we're seeing this in the environment. And one of the things that we are committed to doing is to really, as we stand up a new company, have an incredible opportunity to curate a portfolio that is based on those unmet needs, agnostic to modality. So it doesn't have to be necessarily a drug. It could be a device, it could be a diagnostic, to really make sure that we're listening to what women need. And just right out the gate, very early days, we acquired a company that delivers or provides and designs a device for postpartum hemorrhage. We recently announced also a partnership with an acquisition of a company called Parental, which has a leading candidate in endometriosis, which is incredibly exciting, and polycystic ovarian syndrome, and also another one focused on preterm labor. So I think there is a really incredible opportunity here for us to reconnect with women. I think women are becoming more aware, more conscious of what the issues and gaps are. I think COVID-19 has brought a new level of awareness and consciousness in terms of what these issues are. And I think from a private sector perspective, and as a company focused on women's health, I think it's really important for us to be really conscious of that, listen to those voices, and make sure that we're delivering from our side the innovation that can solve for some of these issues.
Thank you. And I'll turn now to Pam, sort of in line with some of the things that you mentioned in your presentation. Why do you think there is this gap in women's healthcare, and what are some of the things that you're observing in your work with people who are touched by diabetes?
Traditionally, in 20, 30, 50, 100 years before, all of the studies that were done on men. All of the doctors, they were all male as well. So while there's many, many women working in healthcare, and I think, was it Sophie or one of the presentations where it talked about women hold a lot of higher healthcare positions. This is true because we're typically the caretakers. But those gaps started many, many years ago, and I think over the last few years they've been changing. With the people that I work with and I support, they're mostly women. And honestly, before I was asked to join this panel, I didn't think of it in that context, but women are the caretakers. Even if you don't have children, you're caring for someone. Could be a parent, could be your husband. You're making sure that they're getting their checkups. And so this creates a gap because we're always taking care of other people and putting other people first.
Thank you. Sophie, again, going back to this idea of gaps presenting opportunities, how do you think technology is transforming female healthcare, and where do you think we should go next?
So interestingly, as I was listening to everybody talk, I think my mind settled on Newton's law, which is that every force has an equal and opposite reaction. I think when we talk about empowering women to manage their health effectively, we can't talk about it without also talking about how we empower men to manage their health more effectively. And one of the questions I get asked most about hybrid healthcare is, why is this just for women? And it's like, well, yes, the principles of hybrid healthcare are applicable to all aspects of healthcare. We're focusing on women initially because of the unmet need. But actually, if you imagine the male-female balance in terms of healthcare and caregiving, etc., it's like two people sat at the opposite end of a rope and they're engaged in a little bit of a tug of war. And if you give all of the parental leave and you give all of the support from a caregiving perspective and a community perspective and a mental health perspective to women, and in those aspects, actually, there's very little for men provided today. You know, even though there isn't very much maternity leave here, it's just been increased to 60 days. There's, 5 days of mandated paternity leave now, and before it was 1. If all of that, if men are out here in the workspace and women are here, how are you going to rebalance caregiving? How are you going to enable men to be more proactive in the lives of their children if they've only got 5 days that they can take and women have all the time? And I think caregiving starts at the moment, from the moment of conception. We do a lot more during pregnancy to kind of materially carry and nurture a baby, but then when the baby is born, you have an opportunity to become equally involved. And if society doesn't allow that in the first instance, how can you expect there to be an equal share of caregiving responsibilities when a child is 1, when a child is 5, when a child is 18? It's not reasonable. So I think I think there's a lot that technology can do to enable better healthcare, but actually in the first instance, there needs to be more to be done to recognize the gaps, and also to provide more equity in the workplace and in the healthcare system, full stop. So shared parental leave would be a very good place to start. At NAVTA, we offer 9 months shared parental leave, so that's up to 9 months paid for men and women. And in fact, our CTO and our technical project manager had a baby early this year. They're married. And they ended up sharing pretty much equally the parental leave that we offered to them. I also think, again, what Noha's presentation talked about the increase in domestic violence this year, and there's a reason for that. In fact, there are two. Women were home more, and they were potentially in an environment where they could be subjected to more domestic violence, but also men were a lot more stressed without the stress management tools in place to not inflict that on the people who were dependent on them. So women, yes, needed more help accessing support, but men need a lot more support with their mental health. My husband is terrible at managing stress, and trying to convince him to do anything about it is a short road to nowhere. And I think part of that is because it's not spoken about. It's very taboo. Mental health, suicide is the #1 cause of death in men in the UK between the ages of 25 and 35, and it's increasing. There's again, you talked about the silent pandemic. There's a domestic violence pandemic, but there's a real mental health pandemic among men as well. So I think if we want to change things, technology-enabled or otherwise, we have to look at society as a whole. We have to identify the gaps, and we have to understand that men and women's health is two sides of the same coin.
Thank you very much. I think you bring up some really, really interesting points. And what I take away from what you just shared is the idea that we need to take this holistic approach and look at things as an equilibrium. So one of the things that was mentioned in one of the presentations earlier is the fact that most clinical research historically took place with men. From a psychological perspective, I'm a psychologist, a social psychologist by training. One of the things that we know is for decades, all of the parenting and family relationships research was conducted with mothers because the idea was, well, dads aren't interested and this is a mother's role. So I think at the core of what we're talking about today is this idea that we all exist in an equilibrium and we need to examine what each person's role is, what the societal messages are around that. We need to start to bring awareness and try to reduce some of the stigma, because absolutely we have seen lots of data coming out from all over the world about domestic violence. And as someone who runs a mental health clinic here in Dubai, I can tell you that this is one area where women outpace men in being able to access care and support. They're usually much more comfortable in doing so than men. Also, when they meet with their GPs are much more likely to be able to identify particularly mood disorders and make those referrals for psychotherapy and psychiatric treatment, whereas men are usually much less likely to access our services, and when they do, they're much further along in the process. And if we look at healthcare sort of more globally, one of the things that we know is, promotion, prevention are better than intervention, and if intervention is required, then earlier is better than later. So I think we need to have a lot of these sorts of conversations, and a lot of people are starting now to share stories and experiences and anecdotes that go against a lot of our very deeply entrenched notions, and I think that that's helping us break this down a little bit. Okay. So now I'm going to pose a general question to the panel. This has been on my mind since the news broke a couple of days ago. I'm sure everybody's been having conversations in their circles, and I see smiles, so you already know what I'm going to ask. The UAE recently announced that we're moving to a 4.5-day work week. So my question is, how do you think this is going to impact women, generally speaking? And in particular, do you think it's going to have a net positive, a net negative, or a little bit of both in terms of access to healthcare, both physical and mental?
So I think, again, it depends a lot on the expectation setting at all levels. In the public sector, that's pretty clear. From a private sector perspective, that's really where it's gonna hit. What will materially happen when children finish at 12 o'clock on a Friday afternoon, especially if you have two parents who work, and especially if you have two parents who work in private sector companies where perhaps the expectation is not that they also have a half day off. Will that half day be an extra half day that women lose to caregiving obligations, or will it be a half day that with this 4.5-day week can now be offloaded onto male counterparts? Will the fact that there is now a focus on more of a work-life balance penetrate through the workforce and allow kind of more flexible thinking around part-time working, around home working, around what is done within a home working context as well, both for men and women? Because my immediate reaction as the primary caregiver in our family, and I work, I would say, as with a lot of women I know, a full day. So I'm up with the kids first thing, and I have a 4.5-year-old, a 2.5-year-old, and a 5-month-old baby. So I don't really, talking back to sleep, I don't get a huge amount of particularly good quality sleep either. I work from 8:30 till 2:33 when the kids are at school. Then I'm with them 3 to 7, and then I work 7 to midnight, and that is my day every day, and often at the weekends as well. And so my gut reaction when I heard the news was, oh my goodness me, how on earth? Because I would describe the balance, like work-life balance, as an exercise in precision logistics more than anything else. How on earth am I going to accommodate that? I'm the founder and CEO of the company, so it's difficult to squeeze down to a 4.5 day when our employees are across 11 countries and 8 different time zones, you know? So I think it depends on, I don't know, I'm not a big fan of speculation until things play out. I think let's see how it happens, but I hope that what is at the heart of this initiative, which is a better work-life balance, a happier and more productive workforce, is actually kept at the forefront of people's minds and penetrates through, and that both men and women and children, potentially to a lesser extent, see the benefits.
And I actually agree with Sophie, because I think that, you know, we've been, I would say, catapulted into a new way of working in COVID-19, and we had to kind of balance out how do we juggle both work and family, unpaid care within the home. And I think, you know, what that's brought is that I think we're building a lot more resilience in terms of understanding that we had a preset notion of what work looks like, and now that we have to kind of evolve from there and understand that we have to also be resilient in how we manage it. I'm not saying that it's perfect or we have all the answers, but I'm saying that there is a higher level of resilience. I can say that. I think as women, we're starting to understand that we need to be able to do a better job integrating work and life, because we can't, I don't see it also as a balance. I see it a bit more of an integration. I think it's harder when the children are younger. But I think it's going to be another journey of us learning and relearning how to do things a bit differently.
I mean, for me, you know, when organizations or government sets policy, it's a very strong signal and message that things need to change. And I find this transformation very positive, not because it's going to work or not. I think, again, you know, everyone is different. It might work for some people and not others. But just the simple fact that the policy exists and that it's being role modeled, you know, and applied in the government gives us a choice to adopt that in our life if we would like to, you know, benefit from the 4.5 days. As an entrepreneur myself, my lifestyle is more like Sophie and Pamela, and, you know, we're working 24/7, weekends, etc., to meet the needs of our clients. So honestly, again, on a Friday, we're talking to the US or to another country, and even people who are working in the multinationals, we really don't have a full weekend. But at least, you know, this extra half day will enable us to plan better and have more room for, you know, lifestyle activities. So for me, it's a matter of empowerment. I think this is a great step forward. It's empowering to have a choice, to be able to use this time differently.
Thank you. I can only echo what everyone has said. And yeah, we don't know. Yes, my phone blew up that afternoon, like the messages and everything. And then the biggest thing, everyone was saying different things. And what I saw was how does it affect me? Right? Not me as Pam Durant, but every individual had a different take on it. So in many ways, just like diabetes, no two people are alike. Like if you have diabetes and your friend has, it will be a very different experience for both of you because we're all individuals. And it's great to have this opportunity, as you point out, and I think we have to try to maximize it, set the expectations, and really think about what we want it to mean for us and in alignment with the intention that it was intended for. However, I found myself in reflection and being really honest with myself. The first thing I started thinking was, so what activity now is like my child going to engage in? And it was all about the mother in me, not what I was going to do with that extra time for my health and wellness. I started immediately thinking of how I could support other people in this half day. I'm like, well, and maybe I could do like my group coaching thing on that day because then people will be off and. So it is a good, amazing thing, but we have to make sure that it's used in the right way because it's such a wonderful opportunity.
Yeah, and caregiving is a really, really big consideration because for a lot of parents, schools are probably after nannies the number one support system, and that also raises the question of, we probably, all of us sit in a very privileged echelon here where we're in the 8% of people who maybe earn over 5,000 dirham per month, but what about the 92% who earn less than 5,000 dirham per month? What about all the nannies? At the moment, a lot of nannies only get 1 day off every week. Are they also going to be dropped down to a 4.5-day working week? Is that going to be mandatory? So then for parents who are working, will you need to get a second nanny in? Is it fair that there should be people who, with this new work-life balance focus, are still required, mandated, with very little opportunity or wriggle room to work 6 days a week? I would argue not. And if schools are closing after 4.5 days, then probably parents are going to need more support, not less. So actually the desire to relinquish any additional kind of home help that people have is going to be lower. So that's one of the things I think that I'm really interested to see is how does this really excellent policy and outlook impact people at all levels within society? How can we make sure that it does impact everybody positively? I think also, again, with all public policy, and Noha will know this better than I, there has to be a degree of incentivization, especially when it comes to rebalancing caregiving. If, in general, women have been primary caregivers the majority of the time to date, mostly unpaid, and if, in general, men have been the primary breadwinners, mostly paid, how do you convince people who have previously been paid for all of the work that they do to suddenly not be paid for, say, 30% of it? With great difficulty, I would argue. So if you want that to happen, if you want to rebalance the caregiving split between men and women, there has to be a degree of incentivization, and I would suggest that this has to be government-led. What additional health and wellness perks can be created? Can there be more access to gym membership, more mental health support? Can there be more kind of community activities that are designed to involve the active participation of men? Can there be more spaces created in the UAE that allow this leisure time? So I think incentivization is another big aspect of rebalancing caregiving opportunities, and this change in policy is a good reason and place to do so.
Yeah, and just to add one last thought to build on what Sophie and Pamela were saying is how is it going to impact pay? I mean, we're already underpaid as women, 20 to 30% less than men. So, as workplaces decide on how they're going to implement this law, and now the week is 4.5, is it further going to reduce women's pay? So it's also another consideration when we look at the application of the law.
Yeah, and one more point on what Sophie was discussing about how it's used and what you do. I was speaking with some people in corporate, and already corporate health and wellness is a hot topic, kind of hot, using the term loosely right now. Organizations have been really looking at that and what they can do. But I think with this new work week, you're going to have to really educate your employees how to use it wisely. We can't just kind of be quiet about it in the private sector. The employees will need help navigating it and what that means. And there will be, of course, a transition period. And then maybe that's the time that, let's say if Friday is a half day, then maybe you do take that half day to focus on your corporate health and wellness, because people might be reluctant to come in the first place because they weren't coming in before. So you can get a little more creative around what the Friday will look like, and as you help your employees transition to where they want to go.
Can I add another point as well? I'm thinking, again, in the application, does that mean, that employers may take away, remote working opportunities? Because the flexible working arrangements are usually diverse, flexible time, place, etc. So now, we really don't want to fall back into a model where it's only about, a condensed week of 4.5 days, because that is the law and the policy. We want to keep the different options that suit different individuals as well.
So my takeaways, I guess, from all of the very interesting and valid points that all of you shared are threefold. The first that I just wanted to briefly comment on is this idea of work-life balance. And I really liked how you said work-life integration. because as a psychologist, I don't actually believe work-life balance is possible, and I think it's all about recalibration, and a big part of recalibration is regularly checking in with ourselves to see what we need to do more of and what we can sort of give up as we go through this process. But I think a really salient point that we also need to consider when we were talking about the distribution of paid and unpaid work is that in addition to a lot of the domestic responsibilities that we know women kind of tend to take more on more of all over the world, is this idea of the cognitive load, right? So in addition to actually performing duties, the burden of thinking about things usually falls on the shoulders of the primary caregiver in the household, which is the woman. So Pamela, like what you were saying before, the first thing that came to your mind is which activities are we going to keep and which activities are we going to have to sort of give up? And I know that this news is very raw. Everybody is kind of having their reactions. And I think just like with anything, there are going to be pros and cons. And what we need to do is just sit tight and see how things evolve. The last 2 years have been an incredible exercise in uncertainty. We've had ambiguity, novelty that we've never experienced in such large doses and for such a large period of time. And what we've learned, I think, as a society on a global scale is that flexibility and agility are very, very important. And those are two major pillars of the UAE government and the way that they approach things. So hopefully the spirit of what is being done is going to trickle down and be positive for the health and well-being of women, as well as children, families, men, and every segment of the society. So with that, thank you for your time today.